I'm Kristy Henderson. I am the Vice President for Access, Care Transformation, and Virtual Care for Ascension Health. We look at how to use virtual care services as truly how do I optimize our current model of care in the acute care setting as well as in the home environment, and have integrated technology really to extend care beyond our walls, like many of you all are trying to do. But when we approached this, we looked at it in access, as well as care coordination and virtual care services. And so we opened a center last year that houses all of that. So if you're scheduling an appointment, it's done all through our center, and we schedule for virtual care as well as in-person care. You can't get a bed in the hospital without coming through our center. And so that allows us to integrate technology proactively, whether that's a trigger in the acute care hospital that says, hey, this is a high-risk patient that I need to go ahead and start planning to send remote monitoring tools home with, or we're able to proactively know that, hey, here's the list of patients that are high risk, I'll meet them in the clinic, and then also provide the technology there. So we've really integrated it into our care models and our care pathways, whether it was a readmission prevention effort or if it was a heart failure pathway. We've really just said, you know, this technology is a way for us to do business differently and to really get the patient engagement and outcomes that we need. Our readmission rate for patients that we weren't using this technology for were over 20% for heart failure. So now, month over month, we're consistently seeing our group of the same patients, if anything, they're sicker, of just around 3% readmission rate. And so that's real concrete data that we can turn around to our hospitals and our CFO and others to show the value of this. But what's getting us there is the numbers around patient engagement. And so if you look at your traditional care management where it's a phone call, and then you look at a model where you're using the patient's own device and are connecting to them and communicating either through text or whatever it may be, and then you look at a fully managed kit, the interesting thing is the variation in our compliance and engagement rates with that. And so on our kit, we're maintaining over a 90% compliance rate. And that compliance rate is pretty strict. So you have to check your vital signs, you have to answer health survey questions, and you have a care plan. And so if you deviate from that at all, you get a ding, or we get a ding as a program. And so we're maintaining that, and that's unheard of. But if you look at our phone care management lingering in the 20s and 30% rate, you can't change behavior if they're not ever engaged. And so if you look at our BYOD, where they're bringing their own device and we're connecting with them, we're keeping them in the 80th percentile, still much better than just the phone alone. But we can't get to the outcomes of preventing readmission, lowering cost of care, and empowering people for self-management if we don't get an engagement. But we can then, based on triggers, pull in whoever we need to video chat and engage with the patient in the home so that we really can get to a measurable change that's using just the right dose of each specialty to masterfully orchestrate a new way of life for them. So the possibilities are endless, and so wherever your case managers are and your nurses and transitions of care, wherever all those teams are, their whole entire way of doing business can be changed and be more efficient and more effective using the technology.